project is on aneurysms and pseudoaneurysms by Haley, Anya, and Ashley. What is an arterial aneurysm? It is a bulge in an artery wall that occurs when the artery wall becomes weak. A true aneurysm involves inflammation of all three arterial layers, and these pictures show an example of an aneurysm and what it looks like. The different types of aneurysms are shown here in the pictures. The most common ones are fusiform, pseudoaneurysm, and saccular. Where are arterial aneurysms found? Most common areas are the aorta, brain, legs, neck, intestine, and spleen.
Symptoms of a ruptured arterial aneurysm: pain and swelling, throbbing lump, sharp sudden pain in the upper back that spreads downward, syncope, life-threatening internal bleeding, stroke, heart attack, thrombus, and embolism. Treatments for arterial aneurysms. Medication can lower blood pressure and reduce the risk of aneurysm rupture. Surgery can repair or replace the affected section. The type of surgery depends on the location and type of aneurysm and the patient's overall health. CT or MRI scans can check the size and growth rate of the aneurysm. Lifestyle changes including quit smoking, controlling blood sugar if you have diabetes, eating a healthy diet, and exercise routinely. What is a pseudoaneurysm or false aneurysm? A localized hematoma that forms outside of an artery or the heart due to damage to the vessel wall. Most common cause is catheterization. Where are pseudoaneurysms found? May arise from an artery in the human body, most commonly found around the femoral, aorta, radial, carotid, visceral, and peripheral arteries.
Symptoms of a pseudoaneurysm. This can include tenderness when touching the area, weakness, numbness, swelling or bulging under the skin, redness or warmth at the site. And over here on the right is a picture of what this may look like. Pseudoaneurysm treatment. These are the two most common treatments that we do. First one being ultrasound-guided thrombin injection, and this is when a medical professional uses ultrasound to insert a needle into the pseudoaneurysm and inject a low dose of thrombin. The needle is positioned far away from the pseudoaneurysm neck. As you can see on the right side in that picture, it is focused in the middle of the bulging of that pseudoaneurysm. It doesn't usually require anesthesia, skin incision, or artery occlusion, and it's 95 to 100% accurate. Secondly, we have the pseudoaneurysm compression method, and this is a procedure that uses an ultrasound probe to apply pressure to a pseudoaneurysm in order to stop the blood flow and cause it to clot. After 10 to 20 minutes of compression, you can use a duplex Doppler ultrasound to assess the pseudoaneurysm and check to see if there's any blood flow and to see if the pseudoaneurysm is resolved. Pseudoaneurysm compression can be used on superficial arteries like the axillary, brachial, and femoral arteries, and sometimes to tolerate the pain of compression, patients can need sedation. And over here on the right side again is an example of pseudoaneurysm compression. As you can see in photo B, that's the probe pressing down on the skin, which pushes down the pseudoaneurysm, and the clotting at picture C. What can cause a pseudoaneurysm? A heart cath is the most common cause, and when the cath is at the insertion site, it can sometimes puncture or damage the arterial wall during the procedure. This can result in blood leaking out of the artery into the surrounding tissue, creating a pulsating pseudoaneurysm. And again, on the right side, we can see an example of what this may look like. a puncture through the artery and forming that pseudoaneurysm on the right side. Now we will be playing a video just going over where we can find aneurysms and pseudoaneurysms, as well as how to do a pseudoaneurysm compression.
Today we have Miss Haley here, and we're checking for pseudoaneurysms. One common place pseudoaneurysms can form are in the carotid artery. So here we can see that luckily she does not have anything that we know of right now. Okay, as you can see, there's nothing around to indicate that there's a pseudoaneurysm. So it looks like she is good to go. Even moving down. We're now looking for a pseudoaneurysm in the radial artery, which is another common place they form. And as you can see, we're not seeing anything here. And everything's looking good. Here we're at the mid-femoral artery, a very common place for pseudoaneurysms to form, especially after heart catheterizations. As you can see, there's nothing, no pseudoaneurysms here.
Now we are looking for a arterial aneurysm in the popliteal artery. Aneurysms here are very common because of the wall can be weakened by plaque. So let's Doppler this artery and make sure that it looks okay. And it looks good. All right, now we are looking for another aneurysm in the neck, in the ICA artery. These are very common and actually very dangerous because if it ruptures, it can lead to the brain and cause a stroke. So again, this is the ICA artery. We got some color on it. And now we're going to Doppler it. It looks like everything looks good.
So there are two most common ways that we can cure a pseudoaneurysm. One of them being a injection of thrombin into that pseudoaneurysm to clot it and prevent it from rupturing, and another one being pseudoaneurysm compression. So that's what I'm going to demonstrate today, and basically that compression is when you put pressure on top of the artery with the pseudoaneurysm, and that prevents it from further rupturing into the surrounding tissue. We're going to demonstrate this now with Haley and pretend she has a pseudoaneurysm forming in her radial artery, and I'm just going to put pressure right here on her wrist. We would do this for about 10 to 20 minutes and then check with duplex Doppler and see if that blood flow is still protruding out into the tissue.